Hi, I'm Dr. Doherty. I am the medical director at Viva Richmond, and I have been performing kyphoplasty procedures for over 20 years. A compression fracture is a crack in the vertebral body of the back. Typically, vertebral bodies are much like shoe boxes. They're very tough on the outside, but very thin on papery on the inside. And if you can imagine crushing one of those boxes, and then the walls of the box don't hold any weight and they become like accordions. And this is very much what causes pain in people's backs when they have a compression fracture. Every time they move, every time they cough, every time they roll over in bed, the walls of the vertebral bodies are moving and crushing against one another, causing a significant amount of pain. Simply put, what we do is we use X-ray to place a needle inside the broken bone or that broken box in the back. We can put a balloon inside the box briefly. What that allows us to do is create some space inside the box, and if you can imagine, to lift the top and the bottom of the box to create a little more space and a little more height. Once we do that, we squeeze cement inside the vertebral body. It is very much like very thick toothpaste. It coils up inside the vertebral body and creates an internal cast. And we watch this under X-ray to make sure we get good filling of the bone from top to bottom. This is an example of a kyphoplasty we performed in the office. Here we can see the needle that's been placed inside the bone on the screen. Now I'm inserting a balloon that will be inflated to allow us to jack the top and the bottom of the vertebral body apart to create some more space. The balloon is being inflated slowly. You can see it extend toward the bottom of the vertebral body. The balloon has now been removed, and I'm placing a tube with cement into the vertebral body. Once we're happy with where the tube has been positioned, we can then start squeezing the cement inside the bone. And now we can see the dark cement filling the box. It's extending backwards toward the needle, as well as extending upwards toward the top of the vertebral body. Our goal is to watch this under X-ray to make sure that we get good filling of the vertebral body. At Viva, both at our Richmond and our Fredericksburg offices, we perform kyphoplasty in the office, so the patient doesn't need to go to the hospital. For most patients, the procedure is performed through a tiny nick in the skin, maybe a quarter inch to a half inch in size, and it's so small we typically don't use any sutures to close the incision. The procedure itself takes about 30 minutes or so in the office, and the patient is in the office for about 1 to 2 hours for the entire procedure.